Welcome to the Care Right podcast, your go-to resource for all things elder care. Guiding us through this journey is Annalee Kruger, the founder of Care Right Incorporated, and she has been steadfastly supporting families across the United States. Each episode brings you expert insights, innovative strategies, and practical advice, ensuring that you're well equipped to provide the best possible care for your loved ones. Expect to gain valuable knowledge, learn from real-life stories, and get inspired to take action in your own caregiving journey. So buckle up as we dive into an in-depth discussion of elder care planning and together embrace the journey of caring for aging loved ones on the Care Right podcast.
Hi everyone, Annalee Kruger, owner of Care Right Incorporated and co-owner of Plan for Life Now. Welcome to the Family Caregiver Podcast. We are so excited to have you here. As most of you know, with Care Right Incorporated, we work with family caregivers across the globe. There are over 300 million family caregivers worldwide, and we know that adult kids often get thrust into the role of family caregiving, often without ever having any kind of family conversation or family meeting about the what whens of aging. What's our plan to age in place at home? How much money do we have? Do we have long-term care insurance? How much does care cost? What's the plan if staying at home doesn't work out anymore, or we can't afford it? What does that next step look like? And that's what we do at Care Right. We help families across the globe with those types of care decisions and navigating the healthcare system. And healthcare has done a great job of making the industry incredibly complex and confusing, and so has Medicare and Social Security. And so we have honored to have Miss Marcia Mantell here again. She is like my guru for all things Medicare and all things insurance and Social Security. And so she is kind enough to give us some of her time out of her day to just kind of give us some down and dirty. The more you know, the more informed decisions you can make as a person and as a family. So without further ado, Miss Marcia, tell us who you are and we'll jump right in.
Well, Annalee, thank you. Thank you so much for having me back. I'm always thrilled to be here, and I love your small reach, Annalee, just globally. We're going to talk to 300 million people. So I'm happy to play along. My role is largely in what I'll call the retirement industry. So I come at this whole Medicare, Social Security beast from the retirement perspective, because not only as an adult child who could be a caregiver someday, do we have no idea what we're doing, we also aren't all that prepared for retirement. So I try to help people get better prepared. So understand what retirement is going to look like before you even get sick, right? If you end up getting sick, and what do you want to do? How will you spend your time? How much does it cost? And of course, Medicare is free, so it should be super easy to sign up for it. Oh yeah, I get to tell them it's not free, and we start from there. So that's what I can bring to the party, and I'm happy to share anything down and dirty we can come up with today.
And I get to tell families and educate families that Medicare does not pay for long-term care, and it does not pay for assisted living, and it does not pay for home care. So you either pay for that with long-term care insurance, VA benefits, or private pocket out of your savings and your retirement account. So we'll just get that out on the table right now. Medicare is not long-term care insurance. If you want,
it is not.
You want something to pay for care, you need to be planning ahead and get those policies in place like now. All right, you go. Your turn.
Okay. Yes, but that being said, and you're completely correct. Medicare was never ever set up as a long-term care solution for any of us. It's no one's being cheated. You're not being shortchanged. It's not what it was designed to do. Medicare is a law, and it was specifically designed to accommodate the costs that hospitals weren't getting paid when older people, in particular retirees, were using hospital services. So the hospitals weren't getting paid, the doctors weren't getting paid. The government finally created a program to help accommodate that so that the burden wouldn't be solely on the individual as hospital costs were rising, and the hospitals would get paid. So we have this system that is misunderstood, and people think it's more than it is, and then find out it isn't free. And it sort of sets us up for a great disappointment when we do get sick or a family member gets sick and we're trying to navigate, at the worst of times. So I thought it might be helpful if we just explained to your viewers, and listeners what these parts of Medicare are, because it's also not one thing.
Right.
We've grown up, for most of us, in this era where employers, really employers of almost every size, offer health insurance. And so every October, you check a box. Oh, I'm going to get the XYZ plan, or I'm going to get the LMN plan. And then your paycheck gets docked some money and you go on your merry way, and you have health insurance. Not so with Medicare. Now you are on your own out there floating on a raft in the middle of the ocean and trying to figure this thing out. And what you've got are multiple parts, and I call them the quartet and the trio. And the reason for that is you have two choices to make with Medicare. You're either going to get 4 components that make up just quote Medicare, or you're going to get 3 components that make up Medicare. Both of them start with Medicare Part A and Medicare Part B. Part A, that's the original law, covers the hospitalization. So if you go into a hospital, you won't have crushing debt of paying for hospital care. So Medicare Part A pays for a hospital when you're sick or injured, but only for a certain number of days, hence not long-term care. Part B pays for your doctor, some outpatient services like chemo treatments or dialysis, durable medical equipment. So those pieces get paid for, but you have to pay a premium for Part B. You've already paid for Part A with your FICA taxes as you've been working. So A and B, that's where everything in Medicare starts. But that's cost sharing. It isn't, these A and B wasn't, oh, we're going to just go ahead and pay for every expense you have if you go to the hospital or see a doctor. Now you have to pay for your share. And the way it works is Part A, you would pay your share by paying a deductible. You first dollars out of your pocket. And it's like $1,600 this year. If you have Medicare Part A and go to the hospital with no other coverage, you got to cough up $1,600. Most people don't just have that laying around. With Part B, the structure is different. You pay 20%. Whatever the costs were under Part B, if it's $100,000, you pay $20,000. So what happened here is there was recognition in the insurance industry that regular retirees can't pick up even their share. So you can buy a Medigap, a supplemental policy. You pay a monthly premium along the way, and it covers your share. Yep. And then you need drugs. Who doesn't? So we have Part D, and that is a prescription drug plan that helps you pay for your costs of drugs. Those are the 4 components that make up the quartet. Part A, Part B, Medigap, supplemental insurance, and Part D. And that's one option. Your other option, though, is to get a Medicare Advantage plan or a Part C plan. And again, you need A and B, and you pay for Part B premium, but then you can typically you go into a network and a local area of hospitals and doctors and services and such. And you may not pay a monthly premium, but you pay as you go. It's here, it's $20 here, $50 there, $37.12, whatever it might be. You pay all along the way up until you hit a cap. Usually it's in the $4,000 to $5,000 to $6,000 range, but it can be higher than $8,000 and $12,000 if you go out of network. So already people are confused, right, with all this language. Welcome to Medicare. This is what we're all dealing with. So that gives us the lay of the land, right? So we've got these 2 choices, these 2 lanes, if you will, that we're going to choose. And what I will say when I do help individuals not buy their specific plan, but I help them with the education and navigation through this. I don't really want to be so disparaging and call it a mess, but you know what, Annalee, it's the end of the day and it's kind of a
It's a
mess
mess.
up there. So
It's a mess.
it is. And when you don't have any foundation for this thing, it just makes it so much more complicated. So when I do one-on-one individual custom education and planning, I help individuals, and Medicare is individual. It's not for you and your spouse any longer, or you and your kids who are under 26 or your disabled children. It's one-on-one. It's you and me, it's you and Medicare. As we start to unravel this, what you find very quickly is you have to have this comprehensive coverage. Otherwise, you can't afford future medical expenditures.
Yep.
And you don't get to pick and choose, when you can come in. Like, okay, I'm 65, let's say I'm just retiring, but I'm really healthy. I don't need insurance. Or I'll get A and I'll get B because those are kind of the minimum standards, if you will. And later when I get sick, I'll add supplemental coverage. Yeah, no, you won't.
It doesn't
No
work.
one wants you when you're old and sick. So, kind of like long-term care, you need to get into the game early. And yes, you'll pay some premiums over time that turns out you didn't end up using, but it's for the long haul. And we need to understand that health insurance is not, God willing, you don't need to use it because then you're healthy. But
Right.
it's there for the possibility that you will be sick and you will need care that is wildly expensive. And so
Right.
that's why we need to have this underpinning piece.
And I
So
just want to
that's,
jump in real quick here, just to
of
give a
course,
dose of reality to folks. So, because one challenge I have with people is denial. Well, I'm healthy. We don't have a history of anything in our family. I'm gonna just fall asleep and not wake up one day. People don't think that they're gonna end up with a cancer, or all the people that woke up last Thursday and had a major stroke didn't wake up last Thursday and think, oh, I think I'm gonna have a major stroke and derail my health and my family and my finances and like end up in a nursing home the rest of my life. But you know what? This stuff happens literally every day to literally thousands of people. So let's just be realistic here. We don't get healthier as we age. We don't gain mobility. We don't gain cognition as we age. Like all that stuff starts falling down, right? Like,
yeah.
it's
I talk about we are a machine and not in a bad way, but like your car, you
tear
can
and tear.
only drive that thing so long,
Yeah.
you know, and you hope you get all 30 years on that car, but
But there's no
not if you live in Minnesota, you don't.
and there's no guarantee. So let's just like be
No.
realistic and like plan for worst case scenario, hope for the best, but plan for worst case scenario, because you're right. If you wait too long, you're
Yeah.
not going to have the options that you could have if you would have planned ahead, right?
You really don't. And it's so insulting when I work with individuals. Now, I happen to live in Massachusetts, and we're one of the 4 states that has quite a liberal policy for moving in and out of Medigap plans and Medicare Advantage plans, and switching between and such, even as you age. That is incredibly rare.
Yeah.
The other, 46 states. I had to do math there, Annalee, at the end of the day.
It is late in the day.
Yeah, the other 46 states, you really have no options. Once you pick, I call it pick your lane, so you're in the quartet. If you picked, XYZ insurance company's Medigap, but then you wanted to switch to someone else's Medigap, or you didn't get in on time, I mean, really, I don't mean this to be mean, but you are out of luck.
Right.
Because we have to remember and respect the fact that the insurance industry is a business. So they have to have enough actual cash to pay for care when people need it. So in order to make that happen and make all the P&L work, you have to have the inflow of dollars when you're healthier. And you're right, it does not happen. You're not healthier at 80 than you were at 65. It just doesn't work that way. Even though you might have more bionic parts and those knees and hips have all been replaced, you're not healthier. So you do have to pay your fair share. You have to do it early on. And most states don't let you move in and out the way you think you should be entitled to. Well, you're just not. That's not how the law works.
Yep.
So it is hard. It's frustrating for people. And the one I see a lot, I totally agree with you. I love the enthusiasm, right? And the perspective that as you're approaching 65, it's like, I am so healthy. I take one generic drug. I will never need a drug plan. It costs me $2 a month. I can buy it with good care, good RX. Yeah, no, 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 no. No, just no, Annalee, because you don't know what tomorrow will bring. And to lock your family in, whether you're married or not, someone is going to have to provide some care for you. If you're one of the ones who don't just quietly pass in your sleep after a very healthy 99 years, someone's going to have to carry the burden of the cost if you didn't do your job and do your part. And so don't live in denial. Just put these pins in place, make it as favorable as possible, knowing that I think you might have heard me say this before, Annalee, that we need to take the word affordable out of the language when it comes to anything in the healthcare world. There's
Right.
nothing affordable about healthcare in America. Full
Yeah.
stop. With that as a fact, now put your plans in place, your A, B, D, Medigap, or your Medicare Advantage plan, put them in place to protect you and your family. And it's not hard. It's odd. It's different, and again, you don't have any basis for knowing any of this stuff, but the information is there. There are people who can help you with this. Y'all know how to read. You can go to Medicare.gov and start to do some homework and use the tools on Medicare.gov. That is one of the things I have all of my clients do. Sure, I could take their list of drugs, enter it into the plan finder, and come up with the options they have for their Part D plans. But I already know how to do that.
Yeah.
I want them to get in the game. Now, they may only do it one time, but
Yep.
it is so stunning to see that in your zip code, you have to go to the zip code and county level to
Yeah.
get a cost. And then you find out you have 98 drug plan options
Yep.
or 37. And they're so amazed, like, what is going on? But if you haven't at least given it a try, you're not going to be able to navigate through this very dynamic changing system as you age. And that's going to cost you in the pocketbook. So
Right.
I like
And
to try to protect people from that.
yep. And some of my podcasts, the whole point is to disrupt the thinking that most consumers have that Medicare is going to pay for everything, that it's free. And just when we talk about how expensive healthcare is, because there are so many people that are like, well, I'm healthy, I'll never need care. But the reality is most of us will need care at some point. Right. So when we look at like just the cost, so that you can like kind of wrap your mind around like just care itself, not medications and not anything else, but like just care itself. When you're looking at home care is anywhere from, 28 to $60 an hour. And all of the home care companies have shift minimums. So you can't just get 1 or 2 hours because that's what you think you need. You have to have, 4, 5, 6,
Or
8 hour shifts. So if you're looking at $60 an hour, 8 hour shifts, and you need it 7 days a week or 24/7, ka-ching, ka-ching. And that's why I do all these podcasts, is try to educate families to say, look, listen up. Like, it's not what you think it is. Like, aging, dementia progression, caregiving is not what you think it is. And we have to start having these really frank conversations about true costs of care. And that's why we do the aging planning, so families can start making more informed decisions for future care needs, and understanding that, like if you're in Rhode Island, for example, we have clients in Rhode Island, $16,000 for a nursing home for one parent. And if you have two parents, it's 32
times
grand,
two.
like that.
Yeah.
And you still need to pay medications, you still need to pay for, everything else that they need to be properly taken care of. So, that's why it's so important and that's why I always have like powerhouse guests on like you, Marcia, because because families need to wake up, and they need to know, like, you need to work with a professional. These are complicated industries. Healthcare and insurance
Mm.
industries are really complicated.
They really are. And even before you get into needing care,
Yep.
sometimes I run into situations where I work with higher income people, which is wonderful if you get to be a high income person. Like, yay. They're so shocked how much Medicare alone is just to get into Medicare. It's not for Part B right now this year, 2023. The Part B standard premium is $164.90 a month per person. So when you're married, that's times two. Except that's not how much it really costs for the higher income people. And lots of people are very wealthy that it turns into income throughout
Yep.
retirement. They can be up in the $400 and $500 per person per month with what
Hmm.
we call IRMA, the
Yep.
income related monthly adjustment amounts. And it's all of a sudden, it's the C-suite and it's senior executives and it's people who have, God love them, are making really sizable incomes. And they're going, whoa, 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 wait, what? What do you mean? That's $1,000 a month just to cover my wife and me? And I have to then very sweetly, of course, say, oh, no, sir, that's not what I said. That's just for Part B. You
Yeah.
haven't even bought your supplemental insurance yet. And we don't know what drugs you're on or that your wife or your husband are taking. So we don't know how much your Part D is going to be.
Hmm.
That's the only number we know today. And they
Yep.
really are just shocked at how much this is going to eat into their budget. And then, of course, my favorite part is that I then get to tell them, oh, and don't worry, you don't have to pay that out of your pocket. Like, you're not going to write a check or set up auto pay. Social Security is going to take that automatically out of your Social Security check. And, you could just see people just fall out of their chairs. Like, you have to be insane, Marcia, because this can't possibly be the situation. Again, there's nothing affordable about healthcare in America.
That's right.
So you better
That's
know that going in. So those are some of the things. And the Part D drugs, I know you've seen it too. Oh my goodness. I call them designer drugs. So I
right.
track a basket of drugs. There's your basic, a couple blood pressure generic meds and atorvastatin, the generic for Lipitor. These are things I don't know, many people are on once they get to Medicare. Nickel and dime, right? It's $2 a month. It's $1 a month. It's minimal. And then you get to the designer drugs. And
Yep.
that's every drug you see advertised on TV and every magazine and everywhere. I have nothing against them. Look, they are making people's lives so much better. Comes with a cost. And
Yep.
those drugs, one of them, I forget, I won't name them, but I write about them in Retirement Daily.
Mhm.
One of them, I think the high end is $125,000 for the year. Because guess what? It's not covered by any Part D plans
Right.
because
Yep.
the insurers don't have to cover the drugs. And oh, by the way, just because an insurer might cover a drug this year doesn't mean they're going to cover that drug next year.
Yep.
So we are not in control here. The insurers, the manufacturers, the pharmacies, the hospitals, they're in control. So in order to help our families make the best of a challenging between a rock and a hard place situation, get in the game early,
Right.
learn this stuff, work with us, and we will help you to make the best decisions you can possibly make with the information we know today
Yeah.
when you don't want to.
Yeah, because I imagine that the clients that you work with are very similar to mine in that their eyeballs like pop out of their face when they hear about, because for years they're thinking, oh, Medicare is going to pay for all this long-term care stuff,
Everything.
right? So then when
Yes.
we're working with them on their aging plan, and here's home care, and here's the cost of assisted living or memory care, and your loved one has dementia, they could live 25
Mm,
years with that. And that's a very
right.
expensive disease. And so their eyes are like, oh my gosh, how are we going to afford this? Or what are we going to
Right.
do? And that's why we do these podcasts. And that's why I always, the guests that I have on my podcast are vetted people that I know, I trust, and I do business with. And I just personally have spent a lot of time on Zoom. And, so there's so much value in at least learning, planning ahead, and working with the right professionals that can help you make informed decisions. So if someone wanted to say, oh my gosh, Marcia, everything you said just totally freaked me out, and how do I
Sorry.
how do I contact you, because I want to work with you so that I don't make mistakes trying to figure this out on my own? How's a good way, or what's a good way for people to reach out to you?
Yeah, I would love to work with folks. Best way is my email. So it's marcia.mantell@mantellretirement.com. And Marcia is Marcia. I know, my mom picked that spelling. And Mantell has 2 L's. So marcia.mantell@mantellretirement.com. The other thing I would suggest is that you sign up on my blog, which is called boomerretirementbriefs.com. There's a little window you can just put in your name, and each month when I update, or once a quarter when I update my blog, you'll get an email that you can go in and read the latest. I talk about retirement in general and how boomers are really reinventing the very idea of retirement, all this cool stuff we want to do. And also technical details around Social Security, around Medicare, around these drug plans and how they work and what to look for, where the danger points are. You'll get a lot of good information on the blog as well. And it's not too often, mostly because I'd rather be working individually with people.
Right. And writing and blogs just take time. So
Takes time. Exactly. But it's all fun. It's it's information we just don't even know we need to have. And
yeah.
that's why I'd love to support this podcast, because you are getting out there. We're really not sugarcoating this at all.
No.
We've seen too much bad stuff already, and anyone we can help avoid some of these pitfalls,
Mhm.
that's a good day. That is a really good day for us.
That's right. That's right. And that's the whole goal of working with families, is to help them make informed decisions. Because all too often I'm working with families that thought that they knew how to navigate dementia. They thought they knew how to navigate aging and long-term care and all of the stuff that comes with that, only to find out they were in over their heads. And then I have to try to undo what they thought they knew. And sometimes I can, but sometimes I can't. Like, the
Right.
damage is done. So
It is. And it hits you right in the pocketbook. Or you
yeah,
feel so badly. I'm sure you see this too, when you, the adult child, is the one who has to finally bite that bullet and say, we don't have any more money left. And you're
yeah,
putting mom or dad into a Medicaid facility. You never saw that coming.
right.
Well, you should have seen that coming,
Yep.
even if you're pretty well to do. You can't put yourself, jeopardize your future retirement, your next 30 years, because mom, has dementia or had a stroke, or dad. So these family situations are incredibly complex and incredibly costly, and everybody feels rotten at the end of the situation, all because they didn't get ahead of it.
Yeah, and that's why with my mission with Care Right, it's really to try to reach families proactively and say, hey, if you have aging parents, we need to be talking, because at some point things are going to go sideways, and it's better to like have an outline and a strategy and a plan in place sooner rather than later, instead of doing all of this at the 11th hour when emotions are high, time is limited, and you have to make big decisions, to then find out mom and dad didn't have anything in order, and now now they're having to spend even more money on emergency guardianships and all this, because they didn't have their estate documents in order. Or I've had families that didn't, their parent had dementia and the kids didn't really know it. They didn't know what to look for, or they were in denial, a whole combination of stuff. And then dad never signed up for Medicare because he already had early onset dementia. And then now what do? All that
Right.
stuff. So there's, in my 30 years of working with families, there's nothing that surprises me. I've kind of seen it all, and I'm sure you have too. But again, that's why we use that collaborative team approach, because I am no guru in what you are, with the
And I'm no guru in what you do.
and that's why we work so well together, because that way we know that in our areas of expertise, our clients are properly taken care of.
Yeah.
So I'm so glad that this could be like an all-day workshop, really.
Honestly, it really is. I tend to budget between 7 and 10 hours to do these custom education, navigation, information sessions and build a plan just for enrolling in the various piece parts of Medicare. It takes that long. And really, because people have so many questions. It's not I lecture at you and then you go away and it's magically done.
Right.
It's in a very involved situation.
Yeah, and that's same thing with aging planning, or realistically, it's all crisis management, because most people don't come to us when things are going well. It's things have gone sideways quickly, and now they're like, "Oh, we need you to help fix it," and we can. You're just not going to have the same options that you would have if you would have, if we would have worked together when things were going more well. But it is what it is, and
right.
That's why we do what we do, and but. Yeah, this definitely could be a long, a long podcast, and that's what families will say to me too. They're like, "Oh, well, we won't be one of those families that, is going to be 5, 6, 7 family meetings." But the reality is that that's kind of the average, is because we're not writing out a grocery list. It's not like we're writing out our public, pick and save grocery list. We're writing, we're putting an
Hey, what's on sale today, Annalee? I don't know. That's not what we're doing here.
Right. It is like an actual detailed strategy and a detailed plan. And there's just a lot of things that have to be talked through. And probably the same thing for you. A lot of your folks are coming to you in crisis and trying to figure out what the best plan is now moving forward. So
that's absolutely right, especially when they're losing their jobs unexpectedly. And all of a sudden you have to get quickly into Medicare. This is the federal government. There's no quickly.
There's nothing quick about
it's like, come on. But we can help. And I think for both of us, we're about this mission of getting the word out early.
Yeah.
Don't let people wonder if it's going to be complex. We're here to tell you it is.
Just plan on it being complex, way too complex.
Exactly.
Marcia, it is just always such a delight, always such a hoot. And I just really appreciate your area of expertise, because there are not very many people who legitimately have that area of expertise and know how to talk and communicate that to the consumer. So thank you for all that you do and all the work that you do to help people be on the right plans, and all that education that you do as well. It's so important.
Well, thank you so much, Annalee, and I'm always happy to help out where I can.
I know you are. You're always like, "Oh, sure, I'll jump on a podcast." I'm like, "Oh, thank you."
Exactly. But I can't change the oil in my car, so don't ask me for help with that.
That's
this
fair.
is what I do.
That's fair. Well, Marcia, thank you again for all of your time and your expertise today. It is always a pleasure.
Thank you, Annalee.
Thank you for tuning into the Care Right podcast. We hope today's discussion has provided you with valuable insights. If so, don't forget to like, subscribe, and share our podcast with others who might find it helpful. Remember, Care Right is more than just a podcast. It's a community dedicated to supporting family caregivers with comprehensive care planning, crisis management, and resources for every stage of aging. Stay connected with us for future episodes as we continue to explore essential topics in aging planning, elder care, and financial planning. Until next time, take care, plan wisely, and remember, you're not alone in your caregiving journey.